I'm C1, and this is The Christopher Show. Thank you very much for joining me today. Today is December 30th, 2024, and I would love to talk to you about the 2024 accomplishments of Clover Health, so let's jump straight into that. Clover Health, the CEO is Andrew Toy. He's very passionate about healthcare. He's passionate about improving the quality of care and the cost of care for his members. So to that end, he has Clover Assistant, which he also now has put out there as another line of business with Counterpart Health. So Counterpart Health is out there now. Iowa Clinic signed a contract. We'll discuss some of that in the 2024 accomplishments as we get further into that. But let's start with where were we at the end of 2023? At the end of 2023, we had $510.3 million in revenue. We had a net loss of $70 million. We had an EBITDA loss of $19 million and an MCR rating, medical cost ratio rating of 82.4. 82.4 is really good. We've managed to improve that throughout the year. So in the beginning of the year, they started out by giving guidance. What was the guidance for 2024 that they expected? Well, it's insurance revenue. They expected to be between $1.25 billion and $1.3 billion. By the end of the year, they've now updated that number to $1.35 and $1.375 billion. So they've actually upped it by about $125 million. Adjusted EBITDA at the beginning of the year, they expected anywhere from a $20 million EBITDA loss to $20 million EBITDA at the high end. Since then, they've now updated that, and the latest numbers are $55 million to $65 million EBITDA. You're looking at a huge increase from $20 million loss EBITDA to a $65 million increase. You're looking at about an $85 million difference if you take the two high numbers. If you take the two low numbers, let's say $20 million and $55 million, you're still looking at a $35 million increase in EBITDA profitability. We also managed to make one quarter GAAP profitable. So we're getting very close to profitability, and I can't wait to see what the numbers are that come out for end of year for 2024, but those should be here sometime around March. As I said, January 10th, they'll be giving company guidance for 2025. And then about March, we should get the quarter four numbers as well as the 2024 numbers. I'm excited about that. Our MCR ratio, when they first started the year, they were forecasting 79 to 83%. By end of year, they're expecting 76 to 77% for MCR. So we've also improved that from 79 to 83%. If we take the high end with 83% and the low end with 76%, we can expect top end a 7% increase in MCR. And on the low end of that, if we were just to say we were going from 79 to 77%, we still increased it by 2%. So fantastic results in the improvements in MCR ratio this year. Great job, Anthony Toy. Great job to all of the people at Clover Health. Thank you so much for continuing to improve the tool, which passes on cost to the consumer, cost to the patient at the end of the day, and it improves the quality of care, which allows them to address their medical conditions earlier so that they can get more positive results. Thank you so much for all that you're doing. It's a very noble cause, and we appreciate that. Let's go a little further now. We'll jump to March 19th. Clover partnered with Quartet Health to launch Whole Health. What was Home Health? It's to deliver home care access, medication support, and mental and physical care to underserved and at-risk populations through the Clover Home Care that I discussed earlier. So that was announced March 19th. As we went to April 22nd, we started the year without a CFO. Our CFO resigned in December. April 22nd, we got a new CFO, Peter Keepers, and he's been in that position since then. He's been doing fantastic work. He's been doing a phenomenal job, and he's grown the cash on hand balance to $531 million by the last quarter. I'm curious to see what we have at the end of the year in our quarterly earnings, but again, we won't see that until about March. Let's go to May 7th. The quarter one results came out. They adjusted the EBITDA to $6.8 million. I'm sorry, adjusted EBITDA was $6.8 million. So we were EBITDA profitable. It was 130% improvement quarter over quarter from the fourth quarter to the first quarter. So fantastic job. And then they also announced a $20 million share buyback. It was fiduciary duties that we felt the executives should have been doing for the shareholders, and they finally made us feel like they were looking out for the shareholders. Fantastic job once again. We appreciate that as well. At that quarter, they had 79,000 members, 79,527 insurance members. By the end of the year, they've now increased that number. Before AEP numbers, we were sitting at about 81,250. So I'm excited to see what we've done during AEP, how much our enrollment's gone, and what we've accomplished during that. Going down during May 7th, also the guidance that they provided, they had raised it for the insurance revenue. They raised it for the EBITDA. They went from 20 million negative to 20 million to all of a sudden saying, hey, now we're actually going to be EBITDA positive for the year, 10 million to 30 million. And then the MCR ratio came down again there, and they were forecasting for the rest of the year 79 to 81. As I told you, we finished at 76 to 77% expectations for end of year. The other thing they did on May 7th for the quarter one results is they established BER. What is BER? It is the break-even ratio where total revenues equal total cost. So they finally established a BER ratio. We established that. I'll tell you what that is in a moment, or where we are sitting on that today. I think it's about 80%. I think back then we were about 82.8%. So we've had an increase there as well. But it helps with budget forecasting, strategic planning, and resource allocation. So they established that new metric so that we could move forward with that and understand where our break-even ratio is and better and more effectively manage the business. The other thing they did in quarter one is they cut the SG&A expenses, the selling, general, and administrative, by 18%. So we've seen a lot of improvements in cutting expenses, improving the software, and driving for better results. So great job by the team once again. May 29th, Counterpart Health, they announced that was a new SaaS offering. I call it AI as a service, but software as a service, either one. It's the Clover assistant that is now available to private companies to utilize so that they can improve their medical cost ratios as well. So we're looking at not just doing this for Clover Health, we're also looking at doing this for other providers and helping them to better serve their patients. That's how much Andrew wants to help people identify their medical conditions earlier so they can improve their quality of care and their cost of care. We look at May 29th. That's when they announced that. It has two revenue components. There's a per member per month fee that we get, which is a cloud-based residual, and then a share of the savings of third-party provider plan realizes as well. We get a share of that savings when they realize that. And then in addition to that, Andrew is expanding the workforce by hiring new engineers, new implementation experts, and new commercial sales reps. As we go down, contracts were already in the works for that. They had patented it in August, and now we're sitting at May. The first contract will be signed in September, but before I get there, CMS upgraded Clover's PPO Medicare Advantage plans for 2025 in June. On June 14th, they upgraded it from 3.0 stars to 3.5 stars, which enabled us to be able to pass more benefits onto our members and improve the cost for the members and lower their out-of-pocket cost. So very important that happened because that's for 2025. We are at 2025, so we'll start to see some of that get implemented. June 26th, we regained NASDAQ compliance from a share price component. I won't get into that too much. That's share price. I want to talk more about the company. But we did regain NASDAQ compliance, and we've been there ever since. And more than that, our share price has increased. August 5th, quarter two results and guidance. They once again, this is where we actually had $7 million in GAAP profitability, the first time we were ever profitable. From a GAAP perspective, the MCR at that point for that quarter was 71.3%, which is industry leading. And the BER ratio, we gave guidance for 81 to 83% by the end of the year. And I'll tell you what we are in a moment as we get down to that. The guidance for EBITDA also went up during that quarter. August 5th, they increased the guidance for the year from 50 to 65 million. So again, a huge increase from 10 to 30 million to now 50 to 65 million. They've refined that and zeroed it in even more. And today it stands between 55 and 65 million. September 3rd, Counterpart Health signed their first multi-year deal with the Iowa Clinic. The Iowa Clinic has 1.1 million members. They have roughly 450,000 visits a year, 37,500 visits per month on average if you take that and divide it by 12. They have 250 providers across 40 specialties. It's physician-governed and patient-centered model, which is why why Counterpart Health fits so beautifully with it. Counterpart receives the per member per month fee that I was discussing earlier, and in addition to that, Counterpart Health also receives a percentage of the savings. Let's go to October 10th. That is when we finally had PPO MA plans earn a 4-star rating. That was when we got upgraded by CMS. 95% of Clover MA membership is serviced through its PPO, so that's very beneficial to us. It improves the benefits offered once again, and it lowers the out-of-pocket cost for our patients. It improves the cost of care overall, and again, as I started with on this, that is Andrew's overall mission. Also at that time, HEDIS was announced, Health Effectiveness Data and Information Set. we had an industry-leading 4.94 out of 5 stars, and it's a set of measures that quantify a plan's ability to deliver preventative screenings and comprehensively manage a range of health issues, including diabetes, cancer, and quality of care. Our PPO performed the best when ranking the aggregate score of the HEDIS measures. So again, we are industry leading. Clover Health has a long way to go, but they are on a great path to success, and we should see a lot of that begin to mature and begin to materialize in 2025. We also led measures for consumer assessment of healthcare providers and systems, and we led in the measures for medication adherence as well. So again, 4.94 out of 5 for HEDIS, fantastic rating for that. Again, I can't say this enough. It's about improving quality of care and cost of care for the patient. November 6th, we had the quarter 3 results. Our revenue was up 7% year over year. Our net loss was $8.8 million, but it was a 73% improvement year over year. Adjusted EBITDA was $19.3 million, 614% year over year from $2.7 million last year. Our MCR rating was 78%. It was a 0.63% improvement. And then our BER ratio was down to 82.8. I think we're targeting 80 by the end of the year. I see here that they gave guidance of 81 to 82. So we'll begin to see what that is here soon as well. Again, the guidance that they gave, we should finish the year between $1.35 and $1.375 million. Our EBITDA is 55 to 65 million guidance. And our MCR ratio that we're expecting is 76 to 77%. We should begin to hear something about that in the next quarter results, which should come about March, as I've indicated previously. Finally, what are our year-to-date results for the third quarter? We have $1 billion in revenue. Our net loss is only $24.8 million. It's an 82% improvement over last year. Our adjusted EBITDA is $62.3 million profit. As I said, they targeted $65 million. We're already at $62 million. So it'll be interesting to see where quarter 4 brought us in and if we actually beat the adjusted EBITDA numbers. $87.2 million improvement year over year for EBITDA. We were negative last year. We're positive this year. The MCR ratio, as I said, it's currently 78%. We've had a 3.4% improvement year over year, and the BER ratio year to date is actually 80.6. So for quarter 3, it was the what was the number? It was 82.8, but for the year to date, it's 80.6. Once they developed that measure, they started backfilling that data so they could see what it was in previous years so they can identify trending and things like that. So the Q4, as I said, Q4 results and annual results for 2024 are expected about March 12th. This is what I have up here. Guidance improvements, I've already gone through those. With that, thank you so much for listening today. Clover Health has a great road ahead. They've done a great job in 2024. Feel free to check out my other video where I discussed the 2024 City Global Healthcare Conference where Peter Keepers gave some information there. That'll tell you about the path forward. Thank you so much for listening today. This has been C1 of The Christopher Show.